So, Steve, once you were told that you will need to go for treatment, what was the treatment which was offered to you at that time?
Well, they pretty much offered me 3 right off the top. He said, you can go home and just take what comes. And I kind of laughed at that. And he said we could operate, take out as much as we can, and get what we can. And he said the 3rd, you could start treatment right away, maybe chemo or radiation or something. And I jumped right away. I said, listen, if you can take out as much as you can, I'll take care of the rest. I said, I'll work on the rest. I'll do the medication after that, and we'll see what happens. So I was ready for the operation right away.
Good. So, when I look at renal cell cancer, we always think, can the outcome and prognosis differ depending upon the stage of the disease? Oh, definitely, because usually we look at if they are stage 3, means T3 is 7 centimeters or above, as well as presence of lymph node involvement, that falls into the high risk category. So we know that Steve had a stage 4 disease, and it had gone to the liver as well as the lung. And at that point in time, we needed to do something in order to prevent the cancer from progressing very rapidly. So he elected to go for surgery because we know that kidney cancer has got a lot of the immunological factors and angiogenic factors which drives the cancer. And if we can cut off that sort of supply of these factors into the circulation, at least thereafter we could treat them with some of the novel agents. So your outlook at that time pretty much changed when you came to know you were stage 4 disease. And basically, do you have, since you have gone through this and now you're looking really good, do you have any practical advice for patients who are undergoing a diagnosis of renal cell cancer?
It's a tough question because there's so many different areas you can touch on. But minute you go to the hospital, you should always be positive. Never feel like a victim. Victim mentality just creates a negative flow in the body. So I went thinking I had kidney stones, so I didn't think it was a big deal. And when they diagnosed me as they did, I still really didn't blink because I'm such a positive person. And from the very minute, I just stayed positive, and I just believed that whatever was going to happen was just the way it was supposed to be. And as it happened, it was synchronistic because of how I ended up with you as a doctor.
Yes.
For one thing, I had a different doctor that was on my team who got called away for an emergency because of his wife. And they ended up having me with Dr. Silver, who is part of what he does is research. The other doctor was more old school, so I probably would have been pushed into a different venue. Kind of jumping ahead because the operation was pretty radical. It was a lot longer than they thought it was going to be, more involved, and more damage was done. And they not only took the kidney, part of my liver, lymph nodes, other tissue. They went into the inferior vena cava, which ended up only being at 30% working order right now, which is a side effect from the operation. Nothing to do with the cure of the cancer itself, other than it's something I'm going to have to live with. And then after that, the operation is when I was introduced to you.
Yeah.
And that was within a couple weeks after the operation, correct?
It was basically 1 week after the surgery. Steve comes to my office.
In a wheelchair.
In a wheelchair. And he was really sick. And I had to help him up to get onto the examination table. And he had also developed a big, large clot. So it was not easy. And I said, wow, this is not going to be easy to treat him. And I said to him, you need to recover from the surgery, and we'll see how that happens. Usually we wait for about 4 weeks to start the treatment and decide what the frontline therapy is going to be for him.